Hi, I'm Dr. Mark Luzania. Thank you for taking time out from your busy schedule to allow me to introduce myself and to introduce new techniques in diagnosing and relieving chronic head and neck pain. You may have patients who are suffering daily from head, neck, and shoulder pain, or are experiencing morning headaches that progress into debilitating migraines. Temporal mandibular joint dysfunction, or TMD, is often a large contributing factor for many of these patients, and I believe should be considered in their differential diagnosis and treatment. Over 90% of head and neck musculature and nerve innervations are related to the stomatognathous system. The movement and positioning of teeth and jaws greatly influence the activity of head and neck muscles, and its effect on our patients' head and neck pain should not be underestimated. Until recently, the evaluation of the relationship between patients' teeth, jaws, and muscles has relied largely on subjective interpretation of static data. These methods are no substitute for objective biometric data gathered from a patient's teeth, jaw, and muscles while they are in function. Just as listening to a patient's heart through a stethoscope provides only basic information when compared to the analysis of an EKG, so too is the difference between traditional methods of TMD diagnosis versus a diagnosis from the analysis of objective biometric information. The way in which teeth touch largely determines the jaw's position in the TMJ. So instead of traditional ink markings on static teeth, I evaluate a patient's bite with a T-scan. The T-scan is a diagnostic device that identifies and records patients' bite force dynamics, including occlusal force, location, and timing. The computerized bite analysis is combined with electromyography to evaluate muscle activity of the temporalis, masseters, digastrics, and sternocleidomastoids during various tooth functions. This gives definitive biometric information to find if a patient's bite is causing these muscles to be overworked, and gives me real-time evidence-based data to help find which treatment will allow these muscles to relax, thus allowing the patient some relief from their painful symptoms. Joint vibration analysis is the analysis of vibrations coming from the TMJ. It is non-invasive, diagnostic, and helps me determine with over 90% accuracy whether or not a patient's TMJ has a pathologic condition, a condition that may be contributing to their pain. Magnetic jaw tracking also identifies abnormal jaw movements, movements that are often associated with painful head and neck muscles. I ask that you please consider including a biometric TMD analysis as part of your evaluation of patients with acute or chronic myofascial pain, including those patients who suffer from migraine headaches. Working together and utilizing some of the most advanced diagnostic equipment and techniques available, we can provide your patients with relief from their debilitating pain. Allow me to partner with you in providing drug-free treatment options for your patients. Referrals for a biometric evaluation and treatment of your patients suffering from head, neck, and shoulder pain are very much appreciated. I've included testimonials from several patients who have experienced firsthand the benefits of my advanced diagnostic equipment and techniques for the evaluation and treatment of TMD. Thank you for your time and for the opportunity to create an ongoing positive working relationship toward the common goal of pain resolution and an improved quality of life for our patients. If you have patients who have not responded favorably to traditional treatments for their head and neck pain, and you feel that TMD may be a contributing factor, then please refer them to my office. Thank you. This is Crystal, and actually Crystal, let me have you just share your story.
Okay, so I have been dealing with really excessive migraines when I wake up, and it's really hard for me to just get out of bed and like get my day going. And we've tried everything from Excedrin migraine to codeine prescribed pills, and nothing seems to have like continually been helping. So doctor suggested that we make a mouthpiece that I wear when I sleep, and what this little mouthpiece does is it prevents my back teeth, like my jaw, from locking in. So when I wake up, I don't have any muscle tension in my back teeth. And it's been helping ridiculously, amazingly, and it's been really great. I've been waking up feeling like ready to go, rested, feeling more energized, and it's just really helped me a lot.
Crystal, I don't think I could have said it better myself. You sound like a commercial. And I assure everybody out there this is unrehearsed. I'm just so glad that it's helped you.
Yeah.
And also it's drug-free, and
Yep.
that's another big plus. I did explain to Crystal that if we want to maintain this without being dependent on the mouthpiece, that there are some things that we can go through to do that. But again, thank you so much, Crystal, for sharing your story.
Thank you.
So at this point, we've had very positive results. Elisa's going to go back to her medical doctor. And what are you going to tell your MD?
I'm going to tell her that this has been a great experience. I feel like it's making a very significant and positive difference. And, get her feedback.
Yeah.
And hopefully support for continuing on with the program.
I hope so as well. The ball's sort of in the court of the insurance company
Right.
now. So, actually, you've learned why that mouthpiece is helping, and why is that?
Because it in a sense stabilizes my jaw. So rather than in the past, my jaw had a tendency I'd clench my teeth at night, and it seems I'm also doing it during the day. And when that happens, there's all of this grinding and pressure that's created, which only builds pressure, stress, pain.
Right.
And in relieving that pain, it just stabilizes my jaw area.
Yeah.
And relieves the stress points.
Yeah.
So that my jaw is in a more normalized state, and therefore, I'm not, my body isn't inadvertently creating pressure points that ultimately lead to chronic pain.
Exactly. Yeah. And this is that's a very good explanation of some of the symptoms related to temporal mandibular joint dysfunction, or TMD.
Well, the great news is that after 9 years of suffering from severe migraines, debilitating migraines, I haven't had a single one in the last 3 months, 3+, maybe 3.5.
All right.
Absolutely none. And it is amazing to
That's
live
awesome.
pain-free. I'm so excited.
Yeah.
So excited.
And you had mentioned a change in your demeanor.
Definitely. It's just amazing. You live to learn with pain, and it affects your work, it affects your family life, and I'm just happier. I'm just excited because I'm no longer in pain.
Awesome.
And kids notice that mom is available a lot more, and my husband, I'm sure, is very thankful. But it just seems so much better. 9 years of pain was a long time, so
Yes,
I'm
that is.
excited.
Yay. Well, we're excited for you.
Well, thank you so much.
Well, thank you for sharing.
You're welcome.
All right.
Okay. Well, for many years I suffered from a lot of headaches. I had pretty much all day long and night. And I used to take a lot of Advil, probably 3, 4 in the morning, sometimes 3 or 4 more in the afternoon. And it was getting really old. It's hard on your stomach and everything. So through different people, I met Dr. Luzania, and he thought maybe he could help with some bite adjustment and working on my teeth. So I've come in for it's been probably a year or two. We've been working on this, and we've been adjusting and fixing, and it's improved so much. My headaches during the day are usually almost non-existent. Once in a while at night a little bit. I take Advil maybe a few once a month, but I've given that up, and it has improved greatly. So if it's something that can help you, I just recommend trying it, because it's a painless deal. It takes a little bit of time and a little bit of effort, but if it's something that can help, it's an amazing thing. I know it's helped me, so
Yeah.
it's much better, much better. Yeah.
Had you ever heard of the possibility of your teeth causing this?
A little bit, not a lot, but a little bit. As I've gone through some things, I had some MRIs and looking inside, and nobody finding anything. And so as we looked into some stuff, different people had mentioned maybe it's your bite, maybe it's your teeth, maybe teeth affect a lot. So I hadn't thought of that, but I do now.
Yeah. Well,
It's
excellent.
amazing what they do.
Oh,
It
yeah.
can affect your whole body.
You know, if you'd have talked to me about 5 years ago, I might have shrugged it off also. But it's through experiences that I had with you that, this is certainly a valid consideration.
It is, yeah. I would recommend it.
Well, thank you so much for sharing your experience.
Yeah.
And